Good afternoon and welcome to the last webinar Wednesday of 2024. Today we are joined by Tim Young, Senior Solutions Architect at Contact.io. Webinar Wednesday would like to thank our sponsor, Contact.io. Contact.io optimizes processes and resources by revealing how patients and equipment move through the care delivery. Using AI, IoT, and RTLS, Contact.io helps health systems uncover waste, streamline capacity, improve workflows, and make staff and patients feel safer, seen, and valued. Their asset management solutions enables use cases such as device search for patient care, preventative maintenance, power level management, and loss prevention. The cloud-based IT-friendly platform can easily scale into other offerings, such as staff duress and patient elopement. So for more information, please visit contact.io. Now, just a quick reminder to save the date for our spring MD Expo, which we held at the Pechanga Resort Casino in Temecula, California, April the 15th to the 17th. Join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more information and registration details, please visit mdexposhow.com. Voting is still open online through January the 10th for our second annual Tech Choice Awards. TechNation is honoured to be part of these awards that are 100% nominated by and voted by the HTM industry. Please visit onetechnation.com/Tech Choice Awards to vote for all categories, and the winners will be announced in the March issue of TechNation. Okay, today's webinar, as usual, is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away the last one of our Webinar Wednesday 10th anniversary prizes. Today's prize is a $100 Amazon gift card. So using the questions feature on your dashboard, let me know the answer to the following trivia question. What beverage company has been using Santa Claus in their Christmas advertising campaign since 1931? I'll reveal the answer and the winner at the end of the webinar. Now, today's presentation is pre-recorded, so there will not be a live Q&A session. If you have any questions, please submit them, but I will forward them to the presenter to answer offline after the webinar has finished.
Hello, my name is Andy Smith. I am the content lead at Contact.io, and today I'm joined by Tim Young. Hi, Tim.
Hey, Andy. I am Tim Young, the Senior Solutions Architect for Contact.
A little bit about asset management. I'd love to just hear from you exactly, like, in your words, what that means.
Yeah, I did bring a video, so maybe we kind of start with that so I can show you rather than and then we can talk about it.
Perfect. That's great. I guess, okay, great. Let's roll the video.
Hi, we are Contact.io, a leader in inpatient journey analytics. We use AI, IoT, and real-time location data to help your hospital understand how patients and equipment move through the care delivery so that you can uncover waste, optimize workflows, streamline capacity, and make your staff and patients feel seen and valued. Our solution will help solve one of the biggest, most time-consuming problems faced by healthcare professionals: finding the mobile medical equipment you need when you need it. As you know, it can be hard to find certain assets in any healthcare facility. However, when you need something to get your job done, you need it now. That's where we come in. We make it easy to find any piece of equipment. No more searching hallways and closets. No asking around. No time wasted. Here's how it works. Our Portal-Lite devices are plugged into electrical outlets throughout the facility, and we attach tags to any equipment needing to be tracked. Portal-Lites receive real-time location data from the tagged assets. It's that simple. Once everything is connected, you'll get the precise location of IV pumps, wheelchairs, beds, or anything else. The bottom line? Less time wasted on searching for what you need. More time saved for what you need to do. All we need from you is to make all assets that need tracking available when we set the system up. Ready to take your medical equipment management to the next level with us? Talk to us today at Contact.io.
Thanks for bringing that. I think
My pleasure.
I have a pretty good understanding of what we're talking about now. But in your words, tell me about some of the problems, the specific challenges that our customers are facing that you're helping to work with.
Yeah, there's a lot of them. I usually like talking in buckets of 3 just because it's easy to remember. So equipment utilization and their misplacement, inefficient resource allocation, and then really the simplest one is just, where is my thing? I need to find something because I either need to repair it or for some sort of compliance issue.
Oftentimes, nurses or clinical engineers are looking for equipment and they just can't find it. Maybe it's there, maybe they find it, maybe it's not in working condition, maybe it's out of compliance, and the Contact.io solution manages all of that?
Yeah. I think in the simplest form, I mean, as you can kind of get from the video too, is we're really just shining a spotlight into the dark corners where assets are hiding and really quickly giving you visibility into where they are. And a lot of times just that simple exercise can increase productivity dramatically for all those departments you mentioned.
Yeah, so let's look at it from sort of like an investment perspective then. If all of a sudden you know where all your equipment is, you can increase the utilization of your equipment. Maybe you don't need to rent as many items. Maybe you can even defer future purchases of equipment. All of that is real money.
Oh, absolutely. We kind of, those items that you mentioned, I consider to be hard ROI. You've got a soft ROI that can be justified if you really think long and hard about it. But those hard ROI pieces, like rentals, reducing your fleet size, that just means you're not buying as much as you did the previous year. Those are dollars that are saved.
Yeah, amazing. And from what I understand, we just worked with HCA, and they were able to increase their equipment utilization by 75%?
Yes. Yeah. And not only that, but they realized an ROI within, I think it was less than 6 months, from just rental assets alone. Just the reduction of rental assets.
Just the reduction of rental assets. Wow.
Correct.
And I think we actually did an interview with Noel Hodges over there at HCA. Let's take a look at a clip.
We did 4 hospitals. In our pilots, we ran those, and I don't think it was a week that we were recovering equipment that walked out of our hospitals. I don't even think we made it a week that we didn't start seeing immediate returns. We ran those pilots, we collected that information, we submitted that, and then I think we picked another 30 hospitals. Early. I don't even think we made it a month before we saw the same results. And then that led us to the next rollout, and then ultimately right now with well over 140 locations. I think when we're all said and done, we will have close to 300 physical locations that are being monitored. We will have at least 500,000 assets that are being tracked. We have significantly reduced rentals. 3 out of 4 rentals that we would have done 2 years ago are gone. 6 out of 10 nurse requests for equipment we fulfill internally. There's always a few things that we need that we just don't have, but significant. We're recovering 2 to 3 assets a day that would have previously just disappeared.
I think the last item here that we should talk about is the reality of it. I mean, what's the bottom line? What kind of investment are folks looking at? what does an asset management solution from Contact.io actually cost?
Yeah. Before we jump into cost, I do want to say it's very easy to implement. Solutions like this really don't exist in that the ease of deployment and how fast we can get these in place, which is one of the big success stories we've had at HCA and even a lot of our smaller facilities. So very simple, fast, easy to put in place, all priced very reasonably and easily. That's kind of common theme here, easy. Starting at, I think it's like $140 a bed.
And at Contact.io, pricing is a big differentiator because with some of these legacy vendors, they are charging you by the asset tag. They're charging you by the beacon. They are on premises with wires and hosting fees and maintenance fees. And from if I look at the comparisons, I mean, for some of these legacy vendors, you could switch to Contact.io for the same price as the maintenance with some of these legacy vendors.
Yes, exactly. And I mean, part of the reason we're able to do that is because our system is simple to install, simple to get up and running, it's easy to use, it's easy to maintain because it's in the cloud. So costs for everybody are much lower than they were in the past.
So let's talk about easy, because it's easy to say that it's easy, but what we mean is, well, what exactly do we mean? We mean like there's no wires, right? There's no disruptive installation. I think with HCA across nearly 200 hospitals, I think full deployment was just a few months.
Correct, yeah. And that easy kind of ties into speed. So in each patient room, our average installation time is about 4 minutes. So you think about how if you needed to run cables, get above the ceiling, that has a big impact on operations that are happening day to day and patient care, which is...
We already mentioned maintenance with some of these legacy providers, but what are we looking at with maintenance with Contact.io? I mean, these batteries don't last forever. There must be some fixed cost around maintaining the system.
You're leading like a line of questioning that makes me feel as if I'm some sort of cellular salesman saying no hidden fees, no hidden costs. But it is all rolled up into a single line item. We are taking the burden of maintenance away from groups that previously had to spend a lot of time. I mean, you think about biomed and clinical engineering who have really big interest in getting solutions like this, but have been burned in the past because of huge total cost of ownerships and battery lives that just didn't last very long, and it was just an extra burden. So with Contact.io, we're making a really big difference in having devices that last for years. When the batteries are getting close to expiring, we send you new ones. There's no cost. There's no standing PO that you have to have open for Contact.io to send you batteries. No, we give you new tags, our latest version of the tag, not something old, keeping you up to date and making sure that the system's running. We're all about providing the outcome, which is increasing utilization, helping folks become more productive, getting nurses away from administrative tasks and just back to the bedside so they don't even need to worry about equipment management, all in a very simple and fast way.
We mentioned that HCA can reduce their rental fleet by 75%, and that's like basically instantly, right? Once the system is up and running, you can look at a dashboard and see where everything is.
Well, first of all, you're getting rentals because you think you have a shortage, and now you've got them, you need to return them at some point. It's kind of in the name, rentals. And being able to find them is a really important part. And just like you said, looking at a screen, where are my rentals? Oh, there they are. I'll take them, return them, and I'm not being charged additionally for that. And then as you're using the system, increasing our utilization rate, so we don't need rentals anymore.
And now, Tim, as we're running out of time here, is there one last thought that you might want to leave folks with? We'll have a QR code here where they can scan and go ahead and reach out for further information, or when they're ready to talk, we'll be there. But say somebody who is maybe my healthcare system's too small, or wow, I just signed up for an RTLS tracking system. Any final thoughts or recommendations?
It's one platform. You're logging into one place. It's not 20 different separate apps that need to be downloaded. This is a very simple and scalable solution. So no matter how large your organization is, if you're an 1,100 bed hospital or a 25 bed critical access hospital, the outcomes are going to be the same. We're going to be able to optimize the way your hospital is running.
Wonderful, Tim. Thank you so much. I appreciate you being here and talking us through this. And thanks to everybody who tuned in. If you have any questions or would like to learn more, please reach out. Thanks so much.
Great, thank you so much. I'd like to encourage everyone to visit Contact.io's website to learn more about the services they provide to the industry. So please visit contact.io. As promised, the answer to today's trivia question is Coca-Cola. So congratulations to our winner, Wade Bailey in Georgia. Just a quick reminder, you can obtain your C certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1C credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. If you've missed any of the past webinars, including any by Contact.io, please visit Webinar Wednesday live to view our whole webinar archive. We will be back in January with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you for your time today and your continued support of our webinars. I hope you enjoy the rest of your day and have a very happy Christmas.